Hi and welcome to Chronic Lyme Disease, 7 Natural Steps to Reduce Symptoms. And my name is David Rogers, MS Nutrition. My company name is the Nutrient Balance Center, and it's located in Berkeley, Michigan. And we're going to go ahead and get started. My background is I'm a Michigan-based nutritionist, and I have a Master's of Science in Human Nutrition from the University of Bridgeport. I've developed a health system that corrects deficiencies, eliminates inflammatory foods, discovers hidden allergies, and strengthens the immune system with targeted herbs and supplements. And the system doesn't cure, but it reduces symptoms significantly by making the body extremely healthy. More than 90% of the therapies that I recommend are backed up by university studies and/or peer-reviewed research journals, and the other 10% come from strong clinical experience. And the one problem that any natural practitioner has in dealing with Lyme disease is that very few studies deal directly with Lyme disease in relation to the therapeutic nature. So there's current studies that have to do with prevalence of Lyme disease and the diagnosis and the types of ticks. But when it comes to treatments, except for a few antibiotic trials, there are pretty much no studies that have been done. So basically what we're doing is taking studies that have been done for other conditions that are in many ways similar, and we're seeing how well they work at reducing inflammation for those conditions, and we're taking over those studies and moving them into the Lyme realm. And what I found is that working with many clients and working with myself, I'm a Lyme patient myself, these therapies work extremely well. So here at the Nutrient Balance Center, I do not sell supplements. I do recommend them. I will tell you what to buy and which brands are best, and you shop around for the best deals and shipping, etc. And as I say this, I don't mean to say that any other practitioner would have any bias in recommending a supplement that they sell themselves. However, sometimes there is a shadow of a doubt that another practitioner might have a slight bias, and of course the vast majority don't have any bias. Then they recommend what they think is best. But this is so that you have absolutely zero doubt to know that anything that I recommend is completely what I feel and what I think, and I wouldn't want you to spend any money that you don't have to. This information will be sent out to you within a few days, and we're going to move on. Diet and Lyme disease. Can proper diet kill pathogens? And the answer to that is indirectly yes. You can see the following analogy to understand why. So there's a family and they're slobs, and they leave crumbs around the house for weeks at a time, and mice show up and they eat the crumbs, hide in cabinets, and have babies, and they leave their mess everywhere, including droppings and hair. So because of all the mice and all the problems that the mice are causing, the people are calling an exterminator to set a chemical bomb, but they continue to leave crumbs everywhere. So what happens? We need to take this to its logical conclusion and find out that after the exterminator comes and sets the chemical bomb, the mice all die out. But then, say 2, 3, 4 weeks later, the mice start coming back again. Not the same mice, but new mice. And the reason why is the environment of the house is friendly to these mice. There's food everywhere, there's places to hide, there's places to live. And so what it is that the people have unknowingly or unwittingly set up an environment that is friendly to mice and allows them a home that they like to live in. So this is a big analogy to Lyme disease and its treatments. So throwing crumbs around is an analogy for poor diet, abnormal blood sugar, inflammatory foods, etc. And the mice are correlated to Lyme disease and all the co-infections. The mice droppings and the mess correlates to your symptoms. And the chemical bomb correlates to antibiotics. So actually cleaning up the house and no longer throwing crumbs is what relates to changing your diet and taking the correct supplements and having the right lifestyle and exercise and detox and all the things that I speak about that I'll be talking a little bit about today, and also what I speak with clients about when they come in to see me for consultations. So the 7 therapies that we're going to be going over today are: number 1, reduce sugar; 2, balance fats / no trans fat; 3, reduce ages, and when we get to 3 we'll discuss what ages actually are. Number 4, eliminate deficiencies, and we're going to talk specifically about magnesium, but there are many types of deficiencies, and in consultations we go over and make sure that you or whoever comes for a consultation is totally free of deficiencies. And 5, assimilate enough protein. 6 is a process called earthing or grounding. 7, herbs and oils. So we're going to jump right into the number 1 recommendation, which is to reduce sugar. And by sugar, I'm talking about sugar, high fructose corn syrup, corn sugar, maple syrup, honey, fruit. So if any of those things are listed in the nutrition facts, or you know that you're consuming any of those things, you are consuming sugar. And so what your job is to do is to check labels for sugar content. Don't eat anything with more than 5 grams of sugar per serving at one time. And the reason you're doing this is because you're going to try to reduce your total sugar intake by 90% or more. So what happens if you're at a party at grandma's house and she makes a really good cake and you really want to eat it? As you're trying to get better from Lyme, you're going to want to avoid as much sugar as possible. Do eat it a little bit, so just have 2 or 3 teaspoons full. Savor those teaspoons, or teach your grandma how to make her cake with natural sugar substitutes, which we'll talk about in a little bit, and in that case you would be able to have the cake. So regarding giving up tasty foods, and this is something that nobody really wants to do because of course everyone loves tasty food, but the best diet for chronic disease requires excellent willpower and giving up some very good tasting foods, unfortunately. The diet does not require giving up chocolate, vanilla, steak, eggs, butter, carbs, bread, except for if you have celiac disease. And it doesn't require not going to restaurants. You just have to know which foods are okay to order. Also, you can still have brownies, cookies, muffins, etc., but you must make them yourself or know the ingredients that they were made with and know that those ingredients are okay for you. You must also give up fries, onion rings, chicken nuggets, and all types of soda, except for stevia. And all of this may seem rather hard, but I highly encourage you to consider this question. Would you rather have all of your current symptoms and enjoy all foods, or would you rather be almost completely healthy and give up a few great tasting foods like the ones that I just mentioned? So the answer for me was I was willing to give up those foods, and this is what I've done for the past 7 years. And for the past 7 years I've been 95+% symptom free. And this is what I teach people to do in consultations and what we'll be going over a little bit more today. So going back to the sugar intake, we're splitting up sugar into its 2 main categories, fructose and glucose. And your job is going to be to avoid fructose more diligently. And if we're talking about normal table sugar, or pretty much any sugar that you're going to see in foods, so if it's listed sugar in the nutrition facts, or any of those things I mentioned before, honey, fruit, etc., we're talking about sucrose. So that's the third type, but basically sucrose is the combination of fructose and glucose. So it's a molecule of sucrose that contains half fructose and half glucose. So basically what I'm saying is table sugar has half and half. It has half fructose, half glucose. If we're talking about high fructose corn syrup, which is found in lots of processed foods and in sodas, we're talking about 55 to 65% fructose. So in other words, it's about 10% to 30% more fructose. So it's about that much worse than just general sugar. So why are we avoiding fructose more than we're avoiding glucose? And the first thing is that it's a huge burden on the liver. And the Hepatology Journal in June 2010 found significantly more and worse non-alcoholic fatty liver disease with fructose but not with glucose consumption. And the other thing is that it contributes much more to blood sugar imbalances. So let's look at this complicated looking study here. It says at the top, consuming fructose sweetened but not glucose sweetened beverages increases visceral adiposity and lipids and decreases insulin sensitivity in overweight/obese humans. So take a look at the first bolded point there in the paragraph. It says overweight and obese subjects consumed glucose or fructose sweetened beverages providing 25% of their energy requirements for 10 weeks. So let me break that down. What does it mean? They consumed sugar sweetened beverages. The sugar came either from glucose alone or fructose alone, and it provided 25% of their energy requirements. That means 25% of all of their calories came from just these beverages that were just glucose or just fructose. So although both groups exhibited similar weight gain during the intervention, visceral adipose volume, what does that mean? It means organ fat around your organs like your liver, was significantly increased only in subjects consuming fructose, not glucose. Move to the later bullet points. It says altered lipid metabolism and lipoprotein remodeling, including fasting ApoB, LDL, small dense LDL, oxidized LDL, and postprandial, which means post-meal concentrations of remnant-like particle triglycerides and cholesterol significantly increased during fructose but not glucose consumption. So all those are blood markers, and what they're telling you is that heart disease and diabetes markers all were worsened by fructose, not necessarily by glucose. And in addition, fasting plasma glucose, which means fasting blood sugar, and insulin levels increased, and insulin sensitivity decreased in subjects consuming fructose, but not in those consuming glucose. So basically those are your diabetes markers. Diabetes markers got worse in fructose, but glucose did not affect them. So blood sugar gets worse with fructose, and why is high blood sugar so detrimental? In a study of 869 patients with gram-negative rod bacteremia, and this means bacteria in the blood. It's moderately similar case to Lyme disease, because in Lyme disease it's also bacteria in the blood. But thankfully in Lyme disease there's usually not an increase of death risk, but in this case, the gram-negative rod bacteremia, there is an increase in death risk. And in the study of 869 patients, there was a 12.05% death rate for those with the highest quintile, which means the highest 20% of blood sugar values, and only a 3.3% death rate or mortality for those with the middle or normal range quintile. So that means if you have the highest range of blood sugar, you have a 4-fold increase in death rate. And again, that's for gram-negative rod bacteremia, but the way that we can correlate this to Lyme is the fact that we can see that the bacteria get worse and worse when there's high blood sugar. In other words, the pathogens, the bacteria, are feeding on the high blood sugar. It's just providing them food, just like throwing crumbs around was feeding the mice back in that analogy that we went over. So let's talk about carbohydrates in general and not sugars. Bread, pasta, rice, potatoes, etc., grains, they do all break down into sugar. However, if you keep breaking them down, your final end product only breaks down into glucose, as opposed to in sugar, you're breaking down into half and half. You're breaking down into glucose and fructose. So recall that the glucose does not contribute towards non-alcoholic fatty liver disease or fat around your other organs, which is very unhealthy and contributes to many chronic diseases, nor does it contribute nearly as much towards blood sugar imbalances. And therefore, you should convert 70 to 80% of your grain intake to whole grains because of the vitamin and mineral content. But even if you have 20 to 30% of all your grains that you eat are refined or white grains or white rice, etc., this is okay because you're not having fructose. They're not breaking down to fructose, and that's where the real problems for Lyme take place. This is not the case in celiac disease because, of course, feeding gluten and wheat products can contribute to many symptoms, so that's obviously a separate case. So let's talk about sugar alternatives because, of course, we don't want people to feel totally deprived. Do not use artificial sweeteners, so your sweet and low, your aspartame, etc. We're avoiding all of that, avoiding diet soda. And to have a lot more information on that, I've written a whole free e-report, and it's called Diet Soda Makes You Fatter Than Regular and 10 Other Health Truths, or Shocking Health Truths, I believe. You can find that at nutrientbalance.com/diet soda report, and you can download that for free over there. So what should you use as a sugar alternative? You can use stevia, which is just a simple herb that has no negative health effects. In fact, it might have some small positive health effects in terms of your gastrointestinal balance and health. Do use erythritol and xylitol, which are some of the sugar alcohols which don't get absorbed in your body. They taste good, but they don't contribute towards calories or any type of negative effect in terms of there's no blood sugar increase or anything like that. Xylitol you need to use in smaller quantities because in high quantities there is just the possibility of gastrointestinal upset, so you might get just a small stomach ache. So you could actually avoid xylitol altogether, although xylitol does have some positive effects in that helps to fight cavities very well. In fact, they use that as one of the main ingredients in some natural toothpastes. So for an almost perfect sugar taste with no negative health effects at all, you can use 3/4 erythritol powder and 1/4 stevia powder in recipes in place of sugar. So whatever the recipe calls for in sugar, swap it out. So let's say it's a cup of sugar, it says. All you do is use 3/4 of a cup erythritol powder, 1/4 cup stevia powder, and it should taste almost the exact same. If you invite people over to try your recipe and you don't tell them that there's no sugar, the chances of them saying this doesn't taste like real sugar, they're not going to say that because it really does taste like real sugar, especially at this ratio. If you were to use only erythritol or only stevia, you would notice that it kind of tastes a little bit different. Like erythritol has just a hint of a minty taste and stevia has a hint of a bitter taste. But if you use in this ratio, they kind of cancel each other out and it just tastes real good. So if you want soda, what's a great soda that is sweetened with probably close to this ratio of erythritol and stevia, there's a company called Zevia. They make cola and root beer and other types of soda. You can find it at Whole Foods. And if you're near the clinic here in Berkeley, Michigan, there's a place called the Natural Food Patch in Ferndale, Michigan. They sell it as well. If you're looking for erythritol and stevia powders, you can find those usually at a local health store, or you can find it online, like at iherb.com. Maybe vitacost.com probably has that. So some people might ask about fresh fruit, and that's a good question because unlike straight sugar, fresh fruit does have numerous health benefits. For example, berries have ellagic acid, which is excellent against many cancers. Apples have quercetin, which is excellent against allergies, and the list goes on and on. If you take a look at all of the plant compounds that are found in an apple or in a blueberry or in any type of fruit or any type of vegetable, you would find a list probably about 6, 7, 8 pages long, and each page would just be filled with various phytochemicals, and every single one of them has various effects, and almost all positive effects on the body. So I find it hard to recommend against having fresh fruit. However, there is no getting around the fact that fruit does have a significant amount of fructose, and as we were saying before, Lyme patients or people with bacteria in the blood are very sensitive to fructose because they feed on excess blood sugar. So if symptoms are severe in Lyme disease, eliminate fruit for the time being. If symptoms are moderate, then you can have small amounts of healthy fruit, berries being the best because berries have the most amount of these phytochemicals that have super positive health benefits for you. And if symptoms stay gone, then you can reintroduce fruit at, still I would say at moderate levels, not very high levels, because you don't want to shoot your blood sugar up high, but certainly moderate amount of fruit is fine in that case.